You're watching Fear Files, where horror is real and facts are scarier than fiction. I don't deal in myths or legends. Every story you hear on this channel actually happened. No dramatization, no speculation, just cold, hard evidence that will make you question reality itself. Today's case? The Toxic Lady of Riverside, a medical mystery so disturbing it's been buried for 30 years. Let's unpack the facts. February 1994, California. An ordinary night in the emergency room turned into a nightmare. Gloria Ramirez, 31 years old, late-stage ovarian cancer. She was brought to Riverside Hospital with rapid heartbeat and breathing difficulties. Seemingly, just another patient in critical condition. But what happened next, medical staff couldn't explain. When nurses began drawing blood, they sensed a strange odor, something like ammonia or garlic. One by one, members of the medical staff started losing consciousness. Their bodies were covered with strange burns. Some couldn't breathe. Some went into convulsions. 23 people were affected that night. 5 were hospitalized. What was wrong with Gloria Ramirez's blood? Why did her body become a toxic weapon? Where did the oily crystals in her blood come from? The emergency department was evacuated. The room was treated as a chemical contamination zone. Gloria died 45 minutes after arriving at the hospital, never regaining consciousness. But the scariest part began afterward. Her body's autopsy was conducted in sealed suits, as if she were infected with a deadly virus. Pathologists wore protective suits, respirators, double gloves. Such precautions are usually applied when working with particularly dangerous infections. But Gloria wasn't a virus carrier. She was something far stranger. Laboratories across the country analyzed samples of her tissues. Toxicologists, chemists, hazardous materials experts, everyone tried to find an answer. What turned an ordinary woman into a walking chemical weapon? First theory, mass hysteria. The California Department of Health stated that medical staff simply panicked, and it was all a psychological effect. One person fell, others succumbed to panic. But how does mass hysteria explain chemical burns? Real liver damage in the victims? The strange, oily sheen on Gloria's skin? Nurse Susan Kane spent 2 weeks in intensive care. She developed hepatitis, avascular necrosis of the bones. Her femoral bones were literally dying from the inside. She couldn't walk for months. All this after one contact with Gloria's blood. This wasn't hysteria. This was real. A second theory appeared in a scientific journal and sounded like a science fiction movie scenario. Researchers from Lawrence Livermore National Laboratory proposed a hypothesis. Gloria had been using dimethyl sulfoxide, DMSO, a folk remedy for pain. Many cancer patients use it without a doctor's prescription. But here's what could have happened next. A chain of chemical reactions that no one could predict. DMSO is absorbed through the skin and enters the bloodstream. Under the influence of oxygen in the blood, it transforms into dimethyl sulfone. When medics gave Gloria defibrillation, electric shock, this could have triggered another reaction. Dimethyl sulfone converted into dimethyl sulfate, a highly toxic substance, a warfare poison gas. Her body became a chemical laboratory producing poison. When nurses punctured the vein and drew blood, dimethyl sulfate vapors burst into the air. Colorless, almost imperceptible, deadly. Dimethyl sulfate is used in the chemical industry, but is strictly controlled. It's a carcinogen that can kill a person within minutes at high concentration. It affects the lungs, liver, nervous system. These were exactly the symptoms the affected medics had. Sounds logical, but there's a problem. No one has ever seen a human body produce dimethyl sulfate this way. Never. Nowhere. Not in a single documented case in the history of medicine. This chemical reaction is theoretically possible in a laboratory under strictly controlled conditions. But in a living human body, spontaneously, critics of the theory pointed out the obvious. Extreme conditions are needed to trigger such a reaction. Temperature, pressure, catalysts. The human body is not a chemical reactor. And yet, something poisoned 23 people that night. Gloria's family was furious. They hired an independent expert who conducted his own investigation. His conclusions were even more disturbing. Perhaps it was all about improper disposal of medical waste in the hospital itself. What if toxic chemicals had accumulated in the ventilation system or in the room? What if the staff was poisoned not because of Gloria, but because of the administration's negligence? The hospital categorically rejected this version. Too convenient to blame it all on a dead patient who couldn't defend herself. But there were other oddities. Why were the crystals in Gloria's blood never precisely identified? Samples taken during the autopsy showed traces of DMSO and dimethylsulfone, but not dimethyl sulfate, the very poison that supposedly poisoned everyone. Where did it go? Evaporated? Decomposed? Or was it never there at all? Some researchers suggested a completely different scenario: conspiracy and cover-up. What if there was a leak of an industrial chemical or medical gas at the hospital that night? What if staff were poisoned due to an accident and Gloria was simply used as a scapegoat? A convenient story. Toxic patient sounds better than we violated safety protocols. Documents showed that Riverside Hospital had previously had problems with storing hazardous substances. A few months before the incident, there was a malfunction in the ventilation system. Coincidence? Gloria's mother maintained until the end of her life that her daughter was victimized twice. First, cancer killed her body, then the hospital killed her reputation. Susan Kane, the nurse who suffered the most, sued the hospital. The case dragged on for years. She demanded answers. What exactly affected her? The court never gave a definitive answer. The case was closed. The official version remained unchanged. A combination of a chemical reaction in Gloria's body and mass hysteria among staff. But the medics who were there that night still disagree. It wasn't panic, Susan Kane said in an interview years later. I saw people falling one after another. I felt my lungs burning. My bones were being destroyed from the inside. You can't make all that up in your head. She never fully recovered. Chronic pain, mobility problems, years of rehabilitation. All this after one shift in the emergency room. Other affected medics preferred not to speak publicly. Some were afraid of losing their jobs. Some just wanted to forget that nightmare. But whispers in the medical community didn't subside. What if this could happen again? Years later, new theories emerged. One of the most chilling came from independent toxicologists. What if Gloria accidentally created the perfect storm of chemicals? Besides DMSO, she was taking many cancer medications, chemotherapy, painkillers, antibiotics. Her kidneys and liver were failing, organs that normally filter and eliminate toxins. Her body became a chemical accumulator. Add to this stress, defibrillation, oxygen mask, adrenaline. Perhaps at that moment, a reaction occurred in her blood that science still cannot fully explain. Not magic, not mysticism, just chemistry on the edge of the impossible. But there's also a very dark version that's almost never spoken aloud. What if it was intentional? No, not on Gloria's part. She was a victim. But what if someone at the hospital was conducting illegal experiments, testing new drugs on dying patients. Sounds like a conspiracy theory, but medical history is full of such cases. Experiments on prisoners, tests on the poor, experiments on those who couldn't consent or complain. Gloria was a poor Latina dying of cancer, the perfect victim for those who needed inconspicuous test subjects. There's no proof, but too many questions remained unanswered. Gloria Ramirez's body was buried in a sealed coffin. Even after embalming, she was considered potentially dangerous. The pathologist who conducted the autopsy refused to comment on the case, citing a non-disclosure agreement. What did he see inside that he was forbidden to talk about? Medical records from that night are partially classified. Some documents disappeared from the hospital archive. Several witnesses changed their testimonies months after the incident. Today, 30 years later, Gloria Ramirez's case remains one of the most sinister medical mysteries in history. She's called the Toxic Lady, the Toxic Woman of Riverside, walking chemical weapon. But behind these sinister nicknames is a real woman, a mother, a daughter, a person who fought cancer and lost, and 23 medics who tried to save her but nearly died themselves. What really happened that night in the emergency room? A chemical reaction that science cannot replicate? Mass hysteria that caused real physical injuries? A toxin leak that the hospital covered up? Or something completely different? Something we still don't understand? The truth is buried with Gloria Ramirez. And perhaps that's how it was meant to remain.